Hey everybody, welcome back to my channel. So today we're going to be talking about my transabdominal cerclage recovery as well as my transabdominal cerclage pregnancy with Miss Serenity here. So upon getting discharged from the hospital, Dr. Haney gave me a packet which had my operative notes in it as well as some literature to give to whoever my OB or MFM or whomever would have been taking care of my pregnancy. It was just like information on when I should deliver, what a transabdominal cerclage is, because there are a lot of people who aren't familiar with the transabdominal cerclage, and just things to look out for during my pregnancy and what to do, what not to do during my pregnancy. So upon discharge, we went back to the hotel. We stayed at the Radisson Aqua Blue downtown Chicago, and the Radisson Aqua Blue had a track in the inside of the hotel, which was a good thing for me, because even in June it was really windy and I needed a jacket. But the first night I kind of just relaxed and watched TV with my mom and my husband at the hotel. I really didn't have a big appetite. Yeah, it was kind of weird, and I did need help getting up out of bed to go to the restroom, and help with washing on the first night. The second day, I remember Dr. Haney telling me that the more I walked, the better I would feel. So I decided to get up out of the bed, and my husband took me down to the track inside of the hotel, and we walked around just at my own pace, at my own speed. I also carried with me a small pillow like this one to hold over top of my incision while walking. I kind of held that pillow the whole entire time during my recovery, because when you laugh or when you cough, it can hurt. It will hurt. Sorry guys. Hey babe. So it can and it will hurt. So I kept a small pillow like that over my incision. And also, you don't want anyone to bump into you because you did just have an open surgery. So prior to going to Chicago, I purchased a recliner to sleep in, because in the forum or in the Abby Lupus group, I saw that a few ladies mentioned that it was hard to sleep on your side or your stomach, and I can only imagine with it being an open surgery that I was not going to be able to sleep on my side of my stomach, and I was a little bit upset about that because I'm a tummy sleeper. But me and my recliner, we were best friends when I got back home. Going to the airport, I made sure that we had a wheelchair waiting for us upon arrival on both ends, meaning, you know, when I'm going through the gate at O'Hare, which is in Chicago, and when I came home back to Washington National Reagan Airport. So even if you feel like walking, get the wheelchair. Because you gotta think you just had an open surgery and you don't want anyone to accidentally bump into you. And like I said, the airports could be busy. You know, you just... Okay. Oh, okay. The airports can be busy and you don't want anyone to bump into you. So, just a hot tip. So also, this music is throwing me all Serenity. So yeah, after that, once I got home, I kind of just used the recliner. As I mentioned before, my husband was helping me up and down, in and out of bed at the hotel, and he kind of hurt himself. So once we got home, I didn't have as much help, and lucky for me, I really didn't need it because I made sure that I walked a lot. During the flight home, I made sure that I got up and walked throughout the aisles to reduce the risk of blood clots. You know, even though I did travel back home 2 or 3 days after surgery, I still wanted to take extra precautions. So yeah, once I got home, my husband had to go back to work, so it was like I was home alone, so I had to care for myself. My mom would have came over to help me, but I really didn't need the help because I was feeling okay. I just stayed on top of my pain medications and made sure that I took at least like 10-minute walks once every 2 to 3 hours, just around the neighborhood or around the block, or just in my building or in my parking garage. And that really helped a lot. And as far as getting up and down to go to the restroom, as I mentioned, I had the recliner, so that was easy for me too. I would just lift straight up, go to the restroom, come back, lay back down. During my showers, I would just pat my incision site with warm soap and water, and try not to get it wet and keep it dry at all times. So after about 3 weeks or so, I was feeling better. My appetite was back, and yeah, it looked like I'd never been cut, guys. Like, it just looked normal right there. Like, it was, the incision was so low and so small and so thin. It was like, okay, well, what did he actually cut me? You know, which is a good thing. So when I fell pregnant in February of 2019, I started to look for yes, baby. So I started to look for OBs in my area, and I did start to go to GW Hospital. I'm not going to name the doctors there who I was seeing. However, I just didn't feel comfortable with the care that I would have been receiving there. And then I also looked into the mortality rate, just the pregnancy brain going crazy, you know. But I didn't feel comfortable with the care there, so I transferred my care to Dr. Atlas at Mercy Hospital in Baltimore. Dr. Atlas and his assistant Melissa is so bomb, y'all. I'm trying to tell you, like, they are on top of their stuff. From the time I came in, they let me know, listen, we're going to start your progesterone. They did tell me that it was my choice whether or not to do progesterone or not. I did opt to have it done weekly, starting at 16 weeks. I had a nurse to come to my home and give me my injection. I did drive to Baltimore from my part of Maryland. I drove to Baltimore once a week in the beginning of my pregnancy, and then at about, I want to say after 24 weeks, I started going in twice a week. I did get cervical measurements. I did, the cervical measurements did stop at about, I want to say 30 weeks, because we were comfortable at that point. They just made sure that I was comfortable with everything going on. They checked me for gestational diabetes, which I did have. I did have to take metformin, and I did have to check my blood sugars every day, 3 times a day. So, and they did check me for those things early on, so that they can catch those things early on. Like, they were very proactive, I would say. They were a very proactive team, and it was such a blessing to have them caring for my pregnancy. I did get, yes, baby, here. So they were a very proactive team. They caught the gestational diabetes. They caught the gestational diabetes early on, and we were good. I started getting the progesterone injections at about 16 weeks. At about 32 weeks, I stopped getting the progesterone injections because I started getting these headaches. And they were horrible. Like, they were like migraine headaches. So once I She's teething, y'all. So once I stopped the progesterone injections, everything seemed to flow normal. Like it was just like a regular pregnancy. But I never, I'm trying to think of how I can word this. I was never comfortable during my pregnancy. I really think that I had PTSD from my prior losses, and it was, I just pray and study every night, like, or every day rather, just to kind of cope and keep my mind at ease. Any little thing that went wrong, any little twinge that I felt that wasn't right, or any unsettled feeling that I had, I was going to Dr. Google, or I was calling my doctor and Dr. Alice and Melissa, or emailing them, and they would be like, just, it's okay, you are doing great, you know, everything's going to be fine. They always reassured me that everything was going to be fine. But like I said, I had PTSD about things, and I just feel like, oh my God, something's going to go wrong, something's going to go wrong. But it didn't, thank God. And I was due to have my C-section, because you do have to have a cesarean with a transabdominal cerclage. It does stay in until you want to get it removed. So it will be used for multiple pregnancies. So I had my, it will be used for multiple pregnancies. Again, Dr. Ellis and his team, they stay on top of everything. If he would have took my insurance, or the insurance that I had at the time, I may have opted to go with him because he was closer to me, and he's also an awesome surgeon as well, and he did make me feel very, very, very comfortable and safe in his care. So at about, my C-section was scheduled for 37 weeks and 1 day. When I turned exactly 37 weeks, which was the 13th of October, I started just feeling funny, and I had like a little discharge going on. So I was like, okay, let me go to the hospital. Like, they know my face. I would just show up and be like, look, check me in. I don't know what's going on. And it could be something, or it could be nothing. But they did allow me to do that, and they did make me feel comfortable enough to be able to do that, which was a plus for me. But yeah, so 37 weeks exactly. I was supposed to have my C-section on the 14th. I went to the hospital on the 13th. And I was like, look, something don't feel right. What? So yeah, I had an unsettling feeling. And I went to the hospital on the 13th. I was supposed to have I was scheduled to have my C-section on the 14th. But baby was just kind of like, she was really, really active, like super duper active, like get me out of here active. And I was like, okay, I'm going to the hospital. I called my husband, he was still at work. I was like, babe, when you get home, we need to go to the hospital. I of course called my mama. I don't care y'all how old I get, I'm gonna call my mama. So I called my mama, and she came, and we waited for my husband to come. We were all off to the hospital. So once I got to the hospital, they checked baby's heart rate. They, hooked me up to the monitor, and everything was perfect. It was good, but I just had like a feeling like it was crazy. So I want to say like an hour or two passed, and they was like they were going to call my doctor, which is Dr. Alice, to see what he wanted to do. So they called Dr. Alice and let him know everything that was going on. And he said that I was having Braxton Hicks contractions, and it was no need to go back home. He was on his way, and he was going to deliver Serenity right then and there, that day, the day before the scheduled C-section. So I was like, okay, but I was in a shock, like, okay, I'm supposed to have her tomorrow. Mind you, the whole time during my pregnancy, it just was like, I felt weird. Like, as I mentioned, I had PTSD about things. So once he came, he told my husband, you know, get suited up, get ready. They took me to the OR. The anesthesiologist had a chat. They, you know, shaved my stuff, child, and it was on like popcorn. I wish I would have went and got a little wax before, but it wasn't that bad. It wasn't bad. But yeah, so once the anesthesiologist gave me I did have a spinal. So once the anesthesiologist gave me my spinal, he asked me where I felt what tingling at, you know, what areas I felt tingling in, or where did I feel the I guess liquid going down my leg. And once he got it in the right spot, they laid me down. I opted not to have the clear curtain or shield up because I did not want to see that. Like, I did not want to see my body open and something coming out. I don't know. I didn't want to see that. Hey, boo. Toucan? Yeah, I didn't want to see that. So my husband came in once the anesthesia started kicking in, and they started right away. And he was peeking behind the curtain, around the curtain. He wanted to film it, but he couldn't. So yeah, about, I want to say 20 minutes later, Serenity came out. And I was like, I looked at my husband, I was like, where's the baby? Go to the baby. Go with the baby. Why she not crying? And then I heard her cry, and I just started crying. Like, I was bawling my eyes out. It was just the most beautiful thing that could have ever happened. Like, I can't explain it. I'm getting a little choked up right now, but I'm going to keep on pushing through. So... yeah, she was just this little thing, and she was 7 pounds and 19 inches. Well, she was 7 pounds 1 ounce. Yes, baby. She was 7 pounds 1 ounce and 19 inches long. And she just laid on me. They put her on me right away. Once they cleaned her off, they put her right on me, and we were able to do skin to skin because I did submit a birth plan prior to me having my C-section, and they followed it to a T. Yeah, so once she was on me, they never took her off. I did have like a reaction to the anesthesia though. I just kept shaking, and it wasn't because I was cold or anything, and it wasn't intentional. I just kept shaking. So once you know, we got to the room, I kind of used the same recovery tactics or tools for my C-section. I kept a small pillow with me. I made sure that I walked a lot. I drank a lot of fluids. I took gas sacks. I'm sorry, I forgot to mention, child, you're gonna need you some gas sacks, some stool softeners. Okay, the works, you're gonna need all of that. So I made sure that I had those things with me, and I made sure that I stayed on top of my pain medication. Yes, baby. Yeah, I made sure I stayed on top of my pain medications. And yeah, she made it. Like, I was amazed. Like, I'm a mom, I'm a mother, I have a child, even though my stepson has been in my life. Yeah, so once she came out and I had her, like, it was like, wow, I got a whole baby, like, in real life. And it was just such a blessing. That's why her middle name is Miracle, because I really thought that I would never have a child of my own. Yeah, I had my stepson who's been in my life since he was a baby, but you know, it's just a different feeling. He'll always be my son to me, but you know, it is a different feeling, honestly speaking. It is a different feeling, honestly speaking. So yeah, I'm so excited to be a mom. I'm so happy to have been able to be a mom, because there's a lot of people that can't do this on their own or who give up. I'm so happy that I did not give up, that I kept on fighting, and that I have my miracle, Miss Serenity Miracle Davis. Say hi. Say hi, sweet pea. Yeah, so that's going to do it for this video, you guys. Thank you so much for watching. Thank you so much for the positive feedback. You guys really touched our hearts. Please don't forget to like, comment, and subscribe. If you have any questions, yeah, if you have any questions, please feel free to ask them. I'm definitely good with responding back. And let me know if you want to hear about, I don't know, anything that I may have missed, that you may have a question about that I may be able to answer. Just go ahead and ask it. Thank you. Bye, guys. You say bye? You gonna say bye? Say see you later. See you later.